If your ventilated patient becomes agitated, the reflex response is to increase sedation. In many ICU patients, the problem is in agitation. It is ventilator dyssynchrony, and the screen is screaming at you with that figures. Ventilator dyssynchrony occurs when the patient's respiratory effort and the ventilator cycling are mismatched. This mismatch can occur at three levels. It is a trigger dyssynchrony when the ventilator fails to detect the patient's effort. It is a flow dyssynchrony when the inspiratory flow time is insufficient for the patient's demand. It's a cycling dyssynchrony when the ventilator ends the inspiration too early or too late. This leads to increased work of breathing, higher transpulmonary pressures, and potential self-inflicted lung injury. So dyssynchrony is not just uncomfortable, it can worsen the lung injury. Several landmark trials, especially one in the intensive care medicine by Tilly et al., showed that more than 30 to 35% of patients experience dyssynchrony. This would result in longer ventilation duration and higher ICU mortality. For a common dyssynchrony is double triggering, which can deliver the twice intended tidal volume. It can be effectively converting lung protective ventilation into lung injurious ventilation or polytrauma. So if you see two breaths stacked without expiration, that is double triggering, often caused by inadequate inspiratory time or insufficient tidal volume related to the patient's demand. This is one of the common dyssynchronies occurring in ARDS patients. Now don't look at the numbers on the ventilator, look at the waveforms. Three common patterns emerge. Scooped pressure curve, flow starvation, stacked breaths, double triggering, negative deflection before the next breath, ineffective triggering. So the practical fix is that before increasing sedation, optimize the ventilator setting, especially the flow rate and inspiratory time. In mechanical ventilation, remember the ventilator waveforms often diagnose the problem much earlier than the patient deterioration.